So this is Dr. Feast Price, and I will be providing the part 2 of your lecture on diagnosis, assessment, and treatment planning. Thus far, we've talked quite a bit about diagnosis and various forms of assessment in identifying issues that are most salient to the client. I'd like for us to begin by talking about ways of understanding our clients, and we know that assessments is one of the ways by which we get to know and understand our clients. We've already discussed the fact that the DSM provides us with relevant information. We also can rely on assessment tools that are invaluable in helping us to understand our client. But the most important instrument in working with clients is you, the therapist. Research shows that the number one determining factor in one's effectiveness in helping a person to change is the therapist, him or herself. And it's from that perspective I want us to think about ways in which we can understand our clients. So once we gather the relevant data, you must, as a therapist, you must organize and analyze this information into a useful format. Interpretation of assessment data generally involves comparing patterns evidenced by the client in interviews and inventories with pre-established or common patterns. And this leads structure and confidence in the interpretation process. So when all of this information that you've gathered through your observations, through the DSM, through the various forms of assessments, when all of this information intersects, it provides us with the structure and the confidence that we need as clinician for the interpretation. And the interpretation is really identifying what the key issues are, and then from identifying the key issues, then we move into the treatment planning process. But before we get to treatment planning, I'd like for us to talk about some of the key frameworks that are used to understand our clients. The first framework is the theoretical orientation of the counselor. The second is the nature of the client's difficulties. The third is the approaches to treatment advocated by the agency where the treatment is taking place. And there are also the developmental kinds of frameworks. There are multicultural frameworks. There are psychological frameworks that look at the strengths and difficulties. There are psychological frameworks that explore suicidal ideations and behaviors. And so there are also frameworks that explore various psychological aspects, which includes violence, defense mechanisms. There are also frameworks that include medical, neurological frameworks, as well as the individualized framework. But what I'd like to do is just take a little bit of time to unpack each of these frameworks that we've discussed to this point. So in terms of the developmental framework, it's important to know that among many mental health professionals, the developmental framework is perceived to be the most important frameworks by which to understand the development of our client. And it refers to some of the issues that are talked about by Freud, Piaget, Erickson. And these frameworks enable counselors to assess the person's psychosocial, psychosexual, as well as cognitive development, with a particular emphasis on some of those earlier years of childhood and earlier years of development. The multicultural framework is another way that we can view people through a multicultural lens. And this allows us to look at some of the gender, age, context, social economic status, religion, culture, as well as ethnicity in order to understand who our client is and some of the issues that they're presenting. And this provides a literature on a multicultural, it provides a structure for exploring means of comparing clients' individual patterns with what is happening in their environment. So we recognize that not only is one's development an important aspect by which to understand the individual, but also their multicultural background. How does their multicultural background impact who they are and what their issues are that they're presenting with? There are also psychological frameworks, and within these are some of the strengths and difficulties, but of particular importance to counselors or clients is the analysis of people's coping skills and the symptoms of emotional disorders. It's always important to understand how do they cope, and what are some of the difficulties in their coping skills and abilities, their strengths, as well as their resources that exist. A lot of people that I work with that have substance abuse problems have very poor coping skills, and oftentimes substance use and abuse is the means by which they cope. They cope through anesthetizing themselves or escaping their reality. And so it's important to understand how do they cope, what are the strengths, what are the difficulties, and this allows us to best understand how to assist them in overcoming those issues. And oftentimes when we recognize some of the difficulties, then we can help them to develop better coping skills and abilities. Additionally, when we work with clients, first and foremost, what supersedes all else is understanding whether or not there are imminent issues related to suicidal ideations and behaviors. And so here, it's important for us when we assess from a psychological framework related to suicidal ideation and behaviors, we want to understand their motivation, whether it is escape from pain, revenge, attention seeking, or another motive that people have a reason for considering suicide. The second issue is the nature of the plan and the availability of the means are of great importance. And so you want to understand, is there a plan by which the person would carry out this suicide, including the use of a lethal weapon, and also you want to understand whether or not they are at high risk for suicide. So whenever there is some plan of action, then that is a high indication of suicidal ideation, or the likelihood of a person carrying out a suicidal threat or a suicidal thought. Triggering events such as losses, a perceived humiliation or failure, or rejection can also prompt suicide. And so understanding what the triggering events were can be most important in understanding the psychological framework when suicidal ideation and behavior must be considered. Symptoms such as depression, psychosis, anxiety, impulsivity, guilt, hostility, hopelessness, helplessness, emotional dysregulation, misuse of drugs and alcohol are all associated with an elevated incidence of suicidal thinking and behavior. So as counselors, we should pay particularly close attention to people with suicidal thoughts when their depression begins to elevate. And people in the depths of depression may not even have the energy to commit suicide. So an increased level of energy coupled with continuing depression can precipitate a suicidal attempt. And so I've heard people talk about when persons with suicidal ideations are placed on an antidepressant and they start to feel better, at times they have the energy, the mental energy that's needed to carry out issues related to suicide. So it's really important to understand what the symptoms are and how the symptoms can manifest itself to persons carrying out suicidal attempts. Behaviors are also important, and they're especially an important part of the history of an individual, because research shows that if there is a history of suicide attempts, if there is verbalized suicidal ideations, these are all high-risk behaviors, and they are strongly associated with suicide. And so you want to pay particular attention to behaviors, both past as well as present, associated with the individual to determine the association with suicide. Number 6 is family history and support systems, which are other important factors associated with the individual. And research shows that people with fewer supports and a negative family history have a higher likelihood of suicidal behavior. So given the importance of suicide, the lethality associated with having someone with suicidal tendencies, I really want to encourage you to make sure that you have a clear understanding of how to assess suicidality, and also to know that when those red flags go off, that indicates that there is a strong association with thoughts and feelings and symptoms, behaviors associated with suicide, that you call, you get medical personnel involved, inform the police, inform your supervisor, and make sure the proper steps are being taken. So as it relates to psychosocial aspects that include issues related to violence, although most clients are more likely to harm themselves than others, counselors should also be alert to the possibility that clients might engage in physically harmful or destructive acts against other people. And so the most important predictor of violent behavior is a past history of violent behavior. So you always want to get an understanding of the history. History taking is of great importance whenever destructive or harmful behavior is suspected. And so people who are accident prone and who drive recklessly also have an elevated risk for engaging in self-destructive or violent behavior. People who commit violent acts against others are typically male. They typically abuse drugs or alcohol, and they have feelings of failure, low self-esteem, psychological or neurological difficulties. They have problems with paranoid thinking, as well as other associated violent behaviors that coincide with such. So violence, understanding the history of violence, understanding the client from that framework is also very important. Defense mechanisms are also important. All people use defense mechanisms. You use defense mechanisms, so do I. And these are our unconscious psychological processes that help us to balance our instinctual drives and the demands of daily life. So defense mechanisms assist people in coping with reality, deferring gratification, and meeting their needs in socially acceptable ways. So there are a number of defense mechanisms that clients may present with. And just to name a few, narcissism or narcissistic or psychotic defenses are some that clients may present with, especially evident in children and people with psychotic disorders, and they are often reflected in dreams. Immature defenses, which are common in adolescents, as well as people with addictive personality and depressive disorders. These might include acting out, devaluation, introjection, passive-aggressive behaviors, projection or regression, So all of these are some of the defensive mechanisms that relate to immature defenses. There are also neurotic kinds of defenses that are common in most people that might include controlling, displacement, disassociation or externalizing, inhibitions, intellectualization, rationalization, isolation. All of these are very relevant neurotic kinds of defenses that are related to understanding the defense mechanisms that are oftentimes used with our clients. So what are their methods of coping? How are they using various forms of defense mechanisms in order to cope in their daily lives? And oftentimes you see the use of defense mechanisms when working with persons with personality disorders, people that have had to develop these various forms of defense mechanisms when they grew up in environments that were not healthy and nurturing. And another defense mechanism that I want to direct your attention to has to do with mature defenses. And these are common in normal, healthy adults. And these include altruism, or directing energies toward constructive and gratifying kinds of things, anticipation or realistic goal setting, compensation, which are overemphasizing one area of balance, disappointment in one area, or overcorrecting for a limitation. Humor, using non-hurtful wit to make uncomfortable feelings more tolerable. Sublimation, or modifying unacceptable urges into acceptable ones, as well as suppression, which is conscious or semi-conscious postponement of gratification or exclusion from awareness of an impulse. And so what we see here is that there are a number of defense mechanisms. We talked about healthy, unhealthy ones, but we recognize that there are mature defenses that if a client doesn't have, we can help to facilitate the development of these. There are also medical and neurological kinds of frameworks, and even though counselors hardly ever receive extensive training in identifying and understanding medical and neurological symptoms and disorders, often there are sometimes underlying causes of emotional difficulties. And so the only thing I want to say is that sometimes there might be medical issues or neurological issues that might be at the core of what is happening with the client. I already mentioned the gentleman that presented with symptoms that was consistent with schizophrenia, that was a direct relationship to medical kinds of issues. So it's important, particularly with your background in understanding disabilities and diseases, and with all of the courses I'm assuming that you would have had in medical and psychosocial aspects of disabilities, to understand that when working with clients, some of their issues and concerns may be a manifestation of medical or neurological kinds of issues. So you always want to keep those issues in mind when trying to best understand our clients. And then the last framework that I'd like to share a little bit with you about has to do with the individualized frameworks. And what it communicates is that people can serve as their own frameworks of analysis. You know, no two individuals are the same, and we have all had individual life experiences that play into how we make sense of and contextualize the information that our clients communicate to us. And so when we talk about this individualized frame of reference, it's talking about the fact that through interviews and inventories, you as counselors identify typical patterns of emotions, thoughts, behaviors that are characteristic to the client. But the way in which we make sense of information is also related to who we are as individuals and what our life experiences have been, what our training has been. And so we all bring individualized aspects to the work that we do. And so in many ways, that's one of the exciting things that I like in working with clients, that, you know, sometimes I might approach things different from others. But at the end of the day, the most important determinant is the outcome. Because no two counselors will perceive the client exactly the same way. However, it's the end result that we're all aiming for. So there are various processes for analysis and interpretation of the information that we get specific to our clients. Most challenging and creative aspects of diagnosis and treatment planning comes as a result of the information we obtain through understanding our clients, and whether that be through the DSM, through assessment measures, we always are attempting to analyze and interpret the information gathered on a person so that we can identify creative aspects of their diagnosis and their treatment planning. The process involves developing as well as checking out our hypothesis about the significance and importance of the information that we've gathered. And we also want to provide insight. The analysis and interpretation allows us to provide insight and facilitate decisions about the best course for the diagnosis and treatment. And so, as we have talked about a host of areas, from the DSM, the International Classification System, the various forms of assessments that can be used, the different frameworks by we, the therapist, make sense of the client. All of these provide the insight, the creativity needed to understand what is the appropriate diagnosis, and based upon this diagnosis, what is the most important aspects that must be taken into consideration for treatment to be effective. So in an effort for the analysis and interpretation process to be most effective, there are guiding questions that we must take into consideration. And this occurs as we assume an intake interview has been concluded, the inventories have been administered and scored, and any records and other information relevant to the client has been reviewed. For us as counselors, we now begin the process of analysis by asking critical questions to arrive at appropriate information. And the first question is, what underlying themes or repeated issues are present in the information? And these may be obvious, such as a person's repeated negative references to men, demanding and critical father, an abusive first husband, projective testing that shows negative feelings toward men, or job losses stemming from conflict with male supervisors. That's one way of, those repeated underlying themes that we see over and over that tells us that there is a major problem as it relates to male figures. However, often the patterns are more subtle. It's not as apparent what those salient themes and issues are. So, for example, the person may describe 2 recent car accidents and a series of errors at work, and may omit many items during the testing process, such as a person may be prone to self-destructive behavior or disassociation, and may have attentional difficulties, or may be so confused and anxious he feels overwhelmed and out of control. And so you have to receive all this information, conceptualize it, and understand what is most relevant and important as it relates to the client's issues that are presented. You also have to decide what items or issues were given greatest importance by the person. What's most important? And number 3, what usual pieces of information, reactions, or thoughts does the person present? Number 4, what omissions or contradictions appeared in the person's presentation? Sometimes a client may say one thing, and then in other forms of assessment, they might give you totally contradictory information. So paying attention to that. How does a given piece of information fit in with what else is known about the person in his or her environment? And number 6, what frameworks help you, the therapist, to make sense of the information based upon all the different frameworks that we've already discussed? And so there are several guidelines for the interpretation of all of this information that we've gathered. So the first one is you want to avoid becoming judgmental and drawing unjustified conclusions. You know, sometimes as we get to understand the issues, we may go places by perceiving what the issues are that may not be as relevant to the client, and it may be judgmental, and so we need to avoid those practices. We also want to have interpretations that are not pathologizing or condemning or criticizing or further stigmatizing the client. See the issues as limitations that can be overcome rather than seeing the person from a deficit perspective. It's also important that as you interpret the information, whatever interpretation you arrive at should be well substantiated with multiple pieces of information, and you should always be cautious and tentative as you talk about the information that is being presented. Rather than saying, this is what the client has, the client is, in more definitive terms, you say, it appears as though the client presented with, it is possible that, and so these kinds of adjectives are more cautious and tentative rather than more absolutes. And so you definitely want to speak in terms of possibilities. There is the likelihood of, but you definitely want to refrain from using absolutes. The client is, the client will not, because none of us are in a position to speak about absolutes, and so you want to avoid those. So as we move on, I'd like for us to talk about the intake interview and their role in diagnosis and treatment planning. And so intake interviews are very, very important. The purpose of the intake interview is to determine the suitability of a person for the agency services. Not every client that comes in to see you is ideal for the kinds of services that are to be provided. So for example, if you have an outpatient if you work at an outpatient treatment facility, and you know based upon the kinds of needs that the client is presenting, they would be best served in an inpatient treatment facility, then you definitely want to make that referral to the appropriate agency. Number 2, you want to assess and respond to the urgency of the person's situation. This is especially important if the client is presenting with suicidal ideations. Everything is secondary and really irrelevant if the client is presenting with suicidal ideations or certain kinds of medical issues that demand immediate attention. I also see this to be very important if the person is actively using substances. So you want to assess and respond to the urgency of the person's situation, because sometimes other issues have to be resolved before you are in a position to provide adequate treatment. I will say there was once a client with paranoid schizophrenia that was referred to me, and I initially told the referring agency that unless the patient was compliant on their medication that I wasn't willing to see them for therapeutic treatment. And then I had the second notion. I said, well, let me meet with the client for 3 sessions, assess where they are, use the therapeutic relationship and process to help the client to understand the relevance of being on medication. And then by the 3rd session, if I have made no progress, then we'll discontinue the therapeutic process. And what I learned is through the treatment process, the client was able to understand the importance and benefit of psychotropic medication in order for them to maximize their functional potential. The client recognized that there were clearly issues that were posing a problem, like the voices that was limiting their functioning, that was distracting their ability to focus and concentrate and carry out daily activities. They had had lots of bad experience with forced treatment through inpatient treatment facilities. But through the therapeutic relationship, we were able to discuss the history that they had had, the diagnosis, the limitations that their diagnosis was posing, the need for the treatment, how the treatment would work, and then how they would benefit from it, but most importantly, being an active member of their treatment process. So I do know that sometimes you might assume the client may not benefit from therapy, but through the therapeutic process, they can actually move further along in their treatment process. You want to familiarize the person with the agency and the counseling process. I always take some time to tell the person what the agency is about, the kinds of services that are provided, who I am, what I believe in terms of the treatment process. Because I'm a product of therapeutic counseling, I always share with the client that, I'm a product of therapy, that therapy really works, that it is required that they commit themselves to working hard. I let them know that therapy is sometimes painful and that oftentimes issues that are discussed within the treatment context is also a part of their thought processes once they leave the therapeutic treatment setting. And I also affirm for them that if they're willing to work hard, that there's a pot of gold at the end of the rainbow, but getting there will not be easy. So it's always important to help the client to become familiar with the agency, what the agency will do and will not do, the number of sessions that are available, and the counseling process and what to expect in that treatment process. You want to begin to engender positive client attitudes toward the counseling process, and oftentimes that's done through sharing relevant information and giving the client an opportunity to express their fears and their concerns with being in treatment. For many clients, being in treatment is a very daunting and scary process, especially if they grew up in a culture where therapy was perceived as taboo, and to go and share your innermost thoughts, feelings, and experiences with a therapist is counterproductive. And so to allow the client to share their experiences and their thoughts, feelings, and perceptions, to give them a safe place to process that information, will help to engender a positive attitude toward the counseling process. Another purpose for the intake interview is to gather sufficient information on presenting problems, the history, the dynamics to allow formulation of a diagnosis and treatment. And so there's a lot of important information that is exchanged between the client and the counselor, especially in the first session, but also other sessions as well. But the first session is extremely, extremely important to the therapeutic process as well as to the relationship, the therapeutic alliance that is established between the counselor and the client. So just to provide you with an overview of the intake process, so the intake process itself can vary considerably depending on several factors, including but not limited to the personnel involved in the process, the approaches to gathering information, the intake schedule or format, the client and the relationship of the intake process to treatment. And so as it relates to the intake personnel, one person might be responsible for gathering information or evaluating a person's mental status, the nature and dynamics of the person's presenting concerns and relevant history. However, in other agencies, clients meet with several mental health professionals as a part of the intake process. And a mental health counselor might gather information on presenting problems and background, and then a psychiatrist will then conduct the physical and mental status examination. And from that process, a referral also might be made to a psychologist for projective kinds of testing and an assessment of one's IQ or intelligence, or to a social worker who will interview family members and make a home visit. So the nature of the intake process can vary considerably depending on who is involved in that process. With regard to information gathering, the manner in which data are gathered is another aspect of the intake process. Nearly all agencies have some kind of standardized intake procedure, and some agencies rely exclusively on information provided by clients through unstructured interviews and demographic questionnaires. But then you might find that there are other kinds of agencies that require more structured kinds of interviews, such as a brief symptom inventory or the behavior and symptom identification scale. And they may also use certain kinds of inventories, such as the Beck Depression Inventory, to assess symptom severity. So agencies have a lot of different expectations in terms of how they go about gathering information, because still further, other agencies might advocate for a broad-based approach to collecting information. And with the client's permission, they might interview family members, close friends of the client. They might request academic as well as medical records. They might contact teachers and employers, all for additional information. Basically, we see that information gathering is a very important part of the treatment process. So depths and duration of the intake process. The intake interview may be as brief as 20 minutes in an emergency room where people who are suicidal or actively psychotic can be seen for immediate treatment. And then on the other hand, the intake procedures can take 4 hours or more, especially in psychological testing, if that psychological testing is involved. And it can span 3 or more sessions scheduled on different days with different mental health specialists. However, most counselors devote 1 to 2 hours to the intake process. So there is some variation, but by and large, it's 1 to 2 hours or 1 to 2 sessions for gathering information. One of the factors that are really important is is with managed care, you don't have as much time to assess for the intake process, and so oftentimes it's done with the first session. Nature of the client. At the outset of an intake interview, counselors should rapidly assess their client in order to meet urgent needs quickly. So, for example, you might have to do the suicidal ideation assessment to see where they are, and that is something that is done very quickly in order to understand the client. And the counselor should consider the sources and stated purpose of the referral, as well as the presenting concerns and the apparent level of the person's motivation and functioning in treatment. So there are 12 topics of an extended intake interview that is really important. And so I'd like to just take a few minutes just to go over some of those areas that are believed to be the most important in an extended intake interview. Identifying information is always important. Overview of the presenting problem and its symptoms, as well as the impact on the person. Information on the mental status exam, other problems and difficulties the person may present with, the present life situation, and information on family of origin and as well as their present family is also of importance. You also want to factor in developmental history, for example, if there were important incidents that occurred throughout the person's life that might have a significant impact on who they are. There may be medical and treatment history kinds of information that helps you to better understand the client. Number 9 is case conceptualization, including the strengths and areas of difficulty for the client, as well as the multi-axis diagnosis, the DSM. That's a very important piece of information. Treatment planning and other recommendations or salient to the extended intake report, and the conclusion and summary or other pieces that you would like to have included in the report. I want to also highlight the fact that the ICF, the International Classification of Functioning, is also a very important tool that will allow you to understand functional strengths and abilities that are most relevant to the client. And so I want to encourage you as you work with clients to always factor in the ICF, the International Classification System, that allows you to focus not so much on the deficits and the limitations of the individual, but also helps you to understand what the strengths and abilities are, because it's from the strength perspective or the abilities and the functionality that we can help a person to move from where they are to where they need to be in a more optimal area of functioning. So treatment planning is where we go to next. And so we want to talk about the nature and importance of treatment planning. And so Seligman is one of those pioneers of counseling, and he talks about the importance of treatment planning, and he states, and I quote, that treatment planning and counseling is the process of plotting out the counseling so that both the counselor and the client have a roadmap that delineates how they will proceed from their point of origin, which is the client's presenting concerns and underlying difficulties, to their destination, alleviating troubling and dysfunctional symptoms and patterns, and establishing improved coping mechanisms and self-esteem. So this is exactly what treatment planning is and how it is most useful for the client. So that is exactly what treatment planning is as per Seligman. So what is the role of treatment planning in the counseling process? Well, the treatment planning process allows us to determine some assurances that the counseling that we will provide to the client is likely to be successful. So it helps the client know that what is provided in the therapeutic context is likely to be successful, because after all, you're focusing on those issues that are most germane to the client. It also allows us to demonstrate a certain level of accountability and effectiveness. So it's almost like your bill of sale. You're saying, these are the issues that you're presenting with. This is what we're going to focus on. And it assures a certain level of effectiveness when the therapeutic process has ended. The treatment planning process also allows us to track the process and the progress that the client has made from the beginning, the middle, and the end of the therapeutic process, and to determine the success of goals that have been identified. It also provides structure and direction to the counselor and to the counseling process. So it really gives you a compass that directs the services that will be provided to the client. And so the treatment planning process, there is a model that is of utmost importance that I'd like for you to use in mapping out how best to work with the client, or the development of the treatment plan. And in order to do that, the acronym Do a Client Map is what will guide you as a model for the treatment planning process. First in the list is diagnosis. You want to be sure and adequately diagnose the issues and concerns of the client. And in order to adequately diagnose, you know that if those issues are not apparent when you first meet the client, then you have to refer to various forms of measurements to help you to arrive at the appropriate diagnosis. The DSM, the Diagnostic Statistical Manual, is one of the sources that will allow you to appropriately diagnose the client. You will also want to use the ICF, the International Classification of Functioning, in order to not only identify what the limitations are as it relates to the DSM, but what are their skills and abilities in light of what their limitations are, their functional limitations. You want to also look for objectives of treatment. So the treatment planning process has specific objectives that you would want to take into consideration. You want to do appropriate assessments where needed. And already we've talked quite a bit about the various forms of assessments to obtain the additional information that is needed in working with clients to identify the appropriate diagnosis and arriving at the appropriate treatment goals that are needed. As it relates to the clinician, the variables most related to success in counseling outcome research are the client-counselor relationship and the personal as well as situational resources of the client. So it's important to recognize the importance of the clinician. Counselors who are emotionally stable, well-adjusted, and optimistic, who have fulfilling lives, are more likely to be effective. Other important counselor qualities that are associated with positive outcomes includes being friendly, likable, patient, and flexible. Effective counselors have realistic self-esteem. They have skills in communicating warmth, empathy, positive regard, and concern. There is involvement in the counseling relationship, credibility as perceived by the client. So it's important to recognize that the clinician is extremely important, irrespective of the assessments that's used, your ability to accurately diagnose the client based upon the DSM and the ICF. The counselor is the most effective ingredient in the therapeutic process. And effective counselors typically assumes a collaborative stance in relation to their client. So they prepare clients for the part they will play in the treatment, and they encourage their clients to be actively involved in problem solving as well as to take responsibility in the treatment process. So an effective counselor will also communicate genuineness, respect, and immediacy. They're interested in and they're committed to their profession, and they view their clients as capable, trustworthy, dependable, and friendly. So I've shared a lot with you about the importance of the clinician. And so when we talk about the treatment planning process, it's just to help you to understand the very important role that the clinician plays in meeting the needs of the client. Location of treatment is another area that is of importance in the treatment planning process. It ensures the identifying of the appropriate kind of counseling agency or the practices that can best be used to help a particular client in meeting their needs. So location of treatment is really important because you don't want to send a client to the wrong facility. You don't want to treat a client in an outpatient treatment facility when what they need most is being in inpatient treatment. Or you don't want to send them to an agency where there is clients who have volunteered for being in group therapy, and then you're referring someone who is required by the court to be in treatment. So location of the treatment is very, very important, and so you want to take those factors into consideration. Interventions are another part of the treatment planning process, and it's included into the Do a Client map model. And the intervention section is really the heart of the treatment plan. And in this part, the clinician specifies exactly what they will do to accomplish the objectives that have been determined. It has to do with whether you'll focus on affective kinds of issues, cognitive, behavioral, systemic, whether you will be solution-focused, brief, you'll provide solution-focused brief therapy. And so this is where some of the interventions come into play. And so if you've had the Theories and Techniques 1 and 2 courses, where there have been a lot of interventions, counseling theories that have been discussed, these are the kinds of interventions that are most widely used in working with clients. Just to give you a little overview, and really just to identify the 10 theoretical models of counseling. There's the psychodynamic, Adlerian, person-centered, cognitive, behavioral, reality, solution-based brief therapy, constructivist therapy, multimodal, and developmental. What you find is that a lot of therapists, including myself, are eclectic in terms of the fact that we use various kinds of treatment modalities. At my core, I'm a cognitive behaviorist, but I am also one that believes in a person-centered approach. I believe in a solution-focused brief therapy approach because, after all, managed care requires that we be solution-focused and brief. At best, you might have 8 sessions, so it's required that you're brief. And so all of these issues are most important when identifying the most appropriate intervention. So moving further in the Do a Client map, number 7, or the E in the acronym, has to do with emphasis. And with regard to emphasis, once the counselor has identified the goals of the treatment process, what you're in essence, you're saying that with these goals, we will emphasize the focus on particular issues. So emphasis has to do with the particular areas that you will be treating related to the client, and they should determine how that approach will be adopted to the particular needs and personality of that client. So you're taking that intervention and you're identifying the intervention that will be used in the different kinds of treatment modalities that you'll use based upon the emphasis that you will be placing on the treatment process. And the emphasis is consistent with the treatment goals of the therapeutic process. The number of people has to do with whether or not you will be providing individual counseling, group counseling, or family counseling. So we know that if it's individual counseling, it's the individual that we'll be working with. If it's group counseling, it will include other individuals that have similar kinds of issues that they are all dealing with in a group context. It's where not only the facilitator or the therapist serves to facilitate change, but change is also facilitated through other group members. And there are different kinds of groups. Sometimes there are open groups, closed groups. And for those of you who have taken or will take the group, the family and group therapy course, it focuses on the therapeutic processes that include either group or family treatment modalities. So timing is another issue that's really important, and many decisions enter into the planning and the timing of the counseling process. Counselors must decide the length of the counseling sessions, for example, whether or not there's spacing in the frequency. Some of my clients, because they might have only 6 or 8 sessions, rather than coming on a weekly basis, they might decide that they will come bi-weekly. So as it relates to the timing, it deals with frequency, the approximate number of sessions. It deals with the length of sessions as well as the duration of counseling. And so with the length of sessions, usually sessions are 50 minutes, 50 to 60 minutes for an individual session. For a group session or a family session, it's typically 90 minutes in length. And also, like I said, frequency. Sometimes clients, rather than coming every week, they might come every other week so they can extend out the therapeutic process. And it also gives them time to do homework outside of the treatment environment. There's the pacing and sequencing. I'm sorry, I already talked about the pacing and sequencing, and that is specific to the timing aspect. But as it relates to medication, sometimes medication is prescribed to people in counseling to help them to overcome debilitating anxiety or even prolonged or severe depression. They might have issues with mood swings or attention deficit, psychosis, or other kinds of symptoms. And so depending on the symptom severity or symptom manifestations, clients, in addition to being in a therapeutic treatment setting where they're receiving counseling, they're also receiving medication as well, a psychotropic medication. Adjacent services is also very important. One thing that we know, particularly in the field of rehabilitation counseling, is that the extent to which we can benefit our clients has to do with our ability to collect with adjacent services. So knowing the kinds of services that exist within the community that we can refer our clients to. For example, a client may have issues that impact their mental health, but if they have no food to eat, no place to sleep, issues related to their mental health are far less important. So you have to be able to meet some of the most immediate needs of survival before you can meet some of the mental health needs. And so in so doing, you have to be able to identify the specific kinds of adjacent services within the community to refer the client to for help. Prognosis is the last piece of the treatment plan, and it indicates the likelihood of accomplishing the objectives in the treatment plan according to the methods identified in the plan. So the prognosis is determined primarily by 2 important factors: the usual prognosis of the mental disorder with which the client has been diagnosed, as well as the particular client and that person's motivation, personal characteristics, and supports. So what's the usual prognosis for a particular disability or mental disorder, as well as the client's motivation, personal characteristics, and supports in order to help them overcome the issue. So there you have it. It's the model for treatment planning that is very user-friendly. It's called Do a Client Map, which is the acronym, and we have covered all of the areas that are most relevant to understanding the treatment planning process. So we've already talked about the fact that theories and strategies for counseling is either affective, cognitive, behavioral, or systemic in nature. This particular slide gives attention to the fact that there are various therapeutic treatment modalities. 40.2% of mental health counselors describe their orientation as eclectic. I see myself as a cognitive behaviorist with eclecticism as a part of the work that I do, but most clinicians see themselves as eclectic. Second to that is cognitive, behavioral, and rational emotive therapy, 17.4%. Humanistic, existential, or person-centered therapy is 11.7%, is what counselors identify themselves as. 6% see themselves as Adlerian. Psychoanalytic has 5.7%. Developmental is 4.3%. Reality therapy 3.2%. Transactional analysis 2.5%. Gestalt 1.4%. Other, for example, psychodrama, feminist therapy might be within the 7.5%. So I'm a firm believer that there is no one size fits all. And so when we work with clients, while I am a cognitive behaviorist at my core, I recognize that there are times I like to even use transactional analysis to understand what the costs and benefits are with certain behaviors. Reality-based, help the client to understand how behavior change is connected with their everyday reality, and developmental kinds of issues. You know, you can't work with clients beyond their developmental status anyway, and so most therapists are eclectic to some extent. Person-centered is essential, particularly if you want to have a good relationship with your client. So this is just to give you a brief overview of therapeutic treatment modalities as it relates to mental health counselors and how they see themselves. Documentation, report writing, and record keeping is important, and so I'd like to just take a little bit of time to bring to your attention the importance of making sure that appropriate records are maintained for your clients. Documentation and record keeping provides clients with important information. It protects client confidentiality. The goals are also to help counselors to organize and remember relevant information. Sometimes what I find is I always do treatment notes, and I've had an incident recently where I gave a client a homework assignment. I had it in my summary, my treatment notes that I gave them the homework assignment, but I failed to read my treatment notes before the client came in. And the client came in, we had a wonderful session, and she left. And it was only when I was on my way home after the therapeutic treatment session that I realized that I failed to go over the homework that the client had completed. And she had the assignment. When I asked her about it, she said, yes, I had it, but it was an assignment that was really painful for her. And so her avoidance was to avoid talking about the assignment. But at a subsequent session, we did revisit the assignment because there was a lot of therapeutic benefit associated with it. My case in point here is to help you understand the importance of organizing and writing down information in your treatment notes. That's really important. But for me, I learned an important lesson in reviewing my treatment notes for the previous session before I see my client, because you see so many clients, it's hard to remember everything. Number 4, it provides direction to the counseling process. It facilitates the authorization process. And there is also an ease of transferring client information from one counselor to another. I recently had a situation where the Social Security Administration office contacted me about some information for my client. He signed a release form. And so it was just really easy for me to print copies of my client notes and send it on to the Social Security Administration office. So having treatment notes, keeping up with effective treatment notes is very, very important. It is highly important. There are ethical issues associated with it, as well as legal implications associated with maintaining appropriate documentation, report writing, and record keeping. And you never know when your documentation can be subpoenaed in a court of law. So it's important to maintain important information. You don't have to give all of the details, but relevant information. Number 7, in terms of the goals of documentation, report writing, and record keeping, has to do with transmitting information on a client. And we talked about this a little bit before, from one counselor to another. There's the transmitting of information that has to occur. And having well-written documents makes the ease of transferring a client to another therapist readily possible. It also allows you to track process, record homework tasks, and the ease of transition from one session to the next. And that ease of transition is wonderful when you read your treatment notes from previous sessions, particularly before you see the client for the session. You want to facilitate revisions in the treatment plans, because there are times when you might start off in one place, and as you get to know the client, they feel more comfortable, they have more ease with conveying personal, private information. You learn things that you didn't know before. And once you have this invaluable information, sometimes it causes you to factor additional information into the treatment process. So you want to facilitate revisions in the treatment plan as more germane information becomes available. It also serves as a protection to you, the counselor. It allows you to protect yourself in terms of what did and did not occur in the treatment process. If a client were to bring charges against you through your board of licensure, your treatment notes can be used to support and defend you as a clinician in working with that particular client. It also facilitates supervision. When working with students where I serve as a supervisor, I like to look at their treatment notes in order to make sure that appropriate treatment is being provided. And you also want to provide written record at termination as a ways to synthesize, organize, and conceptualize all of the processes that took place in the treatment process. So there are progress notes that is one structured format of information documentation. So let's say after you have developed your treatment plan and you want to document the notes from the session, here are two structured formats that can be used in order to record the treatment notes. And the first format is called the TIP format, and TIP is the acronym used in the treatment write-up or the treatment notes. And the T in TIP is themes or topics. So you're identifying the themes or topics that were discussed. The I in TIPS relate to interventions. So what were the interventions used? And P is progress or problems that were identified or addressed within the therapeutic process. And plans always help you to think about where you're going from here. What's the next step in this treatment process? So the TIP format is a widely used format. The SOAP process, or the SOAP format, is another structured format that is used a great deal. It's readily identified in the medical profession, but it looks at the subjective, objective, analysis or assessment, and the plans. So with regard to the subjective process of SOAP, in this section, counselors briefly summarize their impressions of a session, perhaps considering the degree of progress that has been made, the client's mood and perceptions, as well as the client-counselor interaction, and the pace of the session. So any subjective information relevant to the therapeutic encounter is what you would want to include under subjective. With regard to objective, this includes factual information as well as direct observation of the client's progress and behavior, and information on the content and process of the session itself. So, like for example, if the client cries while discussing certain kinds of information, or if the client was angry or depressed, those are objective kinds of information that you would include under objective. So analysis or assessment, the counselor analyze and synthesize the implications of the subjective or objective information. So it's the way by which they conceptualize, analyze, or make some kinds of assessments of the subjective or objective information. And it's particularly important when you want to take into consideration the relationship of the session to the overall treatment goals. So the comments help you to look at how the sessions are moving forward as it relates to the treatment goals that have been outlined. And then as it relates to plans, counselors focus on the future and list tasks the clients have agreed to undertake, anything the counselor needs to do to prepare for the next meeting with the client, as well as areas to be explored or considered in the next session. So these are all relevant for the plan. And what works best is if you can go back and you can look at the plans so that when the client comes, you are prepared to have that continuity from where they ended things when they were in treatment. It's like, it's like you pick up where you leave off and you move further in the therapeutic treatment process. So there are times when as therapists we want to evaluate the effectiveness of the counseling process, because we've gone through all of the major components associated with diagnosing and assessing the problems, and using different kinds of frameworks by which to understand the client. The initial intake interview, we recognize the importance of that, note-taking, developing the treatment plans, but sometimes we have to evaluate how effective the work that we have done has been with the client. So it allows us to review the progress and reinforce the gains that have occurred. It encourages the client to be motivated, and it also serves to facilitate improved treatment planning. And so circumstances that prompt a progress review is, number one, a client's lack of improvement or dissatisfaction. You want to assess what has occurred, what hasn't occurred. I'm willing to bet if there is dissatisfaction, at its core has to do with there's the relationship issues or motivation issues. Number two, new areas of importance that may surface is very important to include a progress review or an evaluation, goals that have been achieved. Number four, insurance companies' involvement. Insurance companies are always wanting a progress report. How are things going? What's the diagnosis? How have they improved? A break in treatment requires that there is some kind of progress review that should be conducted. And counselor and client's desire for the assessment. Sometimes the counselor just want to assess the level of effectiveness, and sometimes the client is wanting to see, how am I in comparison to where I was when I first started. So there are both counselor as well as client reasons for assessing the effectiveness of the counseling process. In terms of the documentation process and report writing, there are closing and termination reports that are sometimes done. The closing report is fairly brief. It's typically 1 to 2 pages in length. It reviews the client's history as well as the developments that have occurred through the therapeutic process. Included are current treatment processes, the client's diagnosis, as well as the progress that has been made through the therapeutic process, the intervention that was used, and sometimes it's multiple interventions, particularly if you're dealing with 2 or more treatment goals. There's the impact of treatment on the issues that were the focus of treatment. And there are also future goals and plans. And so these are just some of the salient key issues that are included in the closing or termination reports that must be done when working with a client. Lastly, I'd like to just highlight follow-up evaluations. I know that in the Theories and Techniques 2 course, there is a lecture on termination and follow-up, and this speaks to the kind of evaluative measure that must be done when you follow up with the client. And one of the things we know is that follow-up evaluations provides us with a way for us as the counselors and our agencies to monitor the effectiveness of the treatment that we're providing to the clients that we serve. So we want to know to what extent we are effective. How many clients prematurely terminate? And when they prematurely terminate, why do they terminate? So not only the counselor, but also the agency values information to understand the level of effectiveness. Sometimes it helps agencies to decide whether the counselors that they have working with clients are most effective with some clients and least effective with others, and whether there are some personnel decisions that have to be made based upon issues related to effectiveness. Follow-up evaluations also provide a vehicle for offering continued help to former clients who might be experiencing difficulties. So if even after therapy the client might be going through ongoing adjustment issues, the client may have to be referred to other kinds of treatment facilities. So if their insurance is no longer providing more sessions, then you would want to help them to find a therapeutic treatment group or support group within their community, or a treatment agency within their community where they could receive additional services. Optimally, a 3-month interval follow-up is what's best, and that 3-month interval would be between the termination process and the follow-up process. So usually you want to give 3 months to determine before you begin the follow-up evaluation, so that you can have a clear indication of whether or not the treatment has been successful. It takes at least 3 months. There's no special format in conducting a follow-up evaluation. However, at times, persons that seek this information might want to have a written questionnaire with structured questions and a structured interview so that the process can be streamlined. But also, if you are most likely to ask the same questions to all of your clients in the follow-up evaluations, you can do various kinds of qualitative assessments on the effectiveness or success of the treatment process. And it's most likely to be able to do that if you have written questions or structured interviews that allows you to compare across clients. So we've covered a lot of important information. I think it gives you a genesis. These two lectures particularly gives you the gestalt of the diagnosis, assessment, and treatment process, but it also helps you to understand treatment planning, report writing, evaluations, as well as the importance of follow-up to understanding the treatment process. I hope you find great value in the information provided. This is it. Thank you for your attention.